Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Oh, there's some noise outside my house. Oh, lots of roofing going on around here. Anyway, lots of rain, lots of leaky roofs, I guess. Okay, so today is Tuesday. It is June 25th. It is 5:03 p.m. Hello, Pamela. So today I'm going to share information from the Anti-Cancer Revolution series from a talk by Dr. Heather Paulson. Okay, she's a naturopathic oncologist. Now, I totally loved her talk. Okay, so I keep saying that, right? We got the ones I'm sharing with you. There were lots that I'm not sharing with you, but the ones that I'm sharing with you kind of made an impact on me, so that's why I'm sharing. So she shares ways to integrate natural therapies with conventional oncology, natural ways to improve effectiveness of treatment and reduce side effects, and supplements to take during your treatment. Now, what I like the most about her talk is there are plenty of people who are afraid to not do conventional chemotherapy. They're afraid that if they just go natural and do only natural options, completely natural, that the cancer isn't going to go away. Now, I understand that fear, okay? So some people choose to do a combination of the two, maybe getting the chemotherapy drugs in lower dosages so that you can still get the benefit of the chemotherapy, but not the raging side effects, and get the benefits of the natural alternative treatments and not risk having the cancer kind of still be around, okay, because of fear of the unknown, right? So most important from her perspective is to make sure the natural options recommended are, number one, that they're safe, number two, they're not going to interfere with your treatment, and three, they're going to enhance your treatment. Okay, so not only is it not going to interfere, but you want it to be doing something good, right? Hey, Marty. So an example, if you're taking a drug metabolized by the liver with the enzyme system called cytochrome P450, so it's the typical, there's so many of them in the liver, but that's the typical metabolizing system in the liver. Hello, Kim. Thank you for all the hearts. So you're taking this drug and it gets metabolized, and then you compare that to the supplement or herbs that are being considered. Okay, so you're taking this drug and it's metabolized by the liver, and you're looking at herbs or supplements that may or may not be metabolized by the liver. Now, if they use the same metabolic pathway, the same system for metabolism, it would not be ideal to use them together. Okay, because they're competing for the same metabolic pathways. Now, I mentioned this before. Some chemo drugs work within the tumor cell, blocking glutathione, for example. So glutathione is an antioxidant in the body. If the chemo drug works to block the glutathione in the tumor cell, clearly, it's to induce the cell to die. If you supplement with glutathione, which is a wonderful supplement because it is an antioxidant, if you supplement during your chemotherapy, you're basically telling your body, it's like confusing your body. So you would not want to do them at the same time. So it would not be the right time to supplement with glutathione. You would want to wait until the glutathione blocking drug is done, whether it's 2 days, 3 days, a week, a month, but you'd want to wait till it was done doing its activity before you supplement it. Now, clearly, this is not something you would do on your own. This is why you need to see a naturopathic oncologist, somebody like Dr. Heather Paulson, to guide you based on your drug treatment, which is based on your cancer. Now, they look at the side effect profile of the chemo medication and start incorporating nutrients that can support that area or reverse any problems. So they look at the mechanism of action of the chemo drug and see if there are any supplements or herbs that can enhance the action of that chemo drug to make it work better, because if you've already committed to using a chemotherapy drug, you want it to do the best it's going to be able to do. So knowing how long drugs are actively working in the body is critical. If the active half-life is 12 hours or 3 days, it would make a huge difference on how you supplement. Sometimes they would suggest stopping supplements for the few days before and after your treatment and then restart once those drugs are out of your system. Okay? She mentions bone marrow toxicity. She says many chemo patients experience low blood counts during treatment. She recommends astragalus, ginseng, ashwagandha, which we know, we've talked about them before, are adaptogens, and they are helping your body combat that particular problem. So if, like I said, bone marrow suppression is common with chemotherapy, so you would want to supplement with things like that. Platinum compounds, a chemotherapy drug used quite often, they're intentionally being used to interrupt DNA replication of tumor cells. Okay, but it can lead to long-term side effects because it deposits in our tissues, in our bones, muscles, and fat. So if you've taken these drugs in the past, you can get a urine test to see what your platinum content in your body is currently. Okay, and then you can actually chelate it out. Chelate basically means to bind to a metal, okay, to bind to it and help your body excrete it. Okay, so you can do that once you're done with your chemotherapy. Currently, if you're currently using it, that's not the time to chelate. The time to chelate is when you're done with your therapy and you want to get rid of whatever residual platinum is left in your body. Okay, so during treatment, you need to watch your kidney function, you need to watch your liver function, you need to watch your bone marrow. But she had all these wonderful suggestions and things that she does in her practice to make chemo drugs work better and to make sure that whatever she's doing is minimizing the side effects of your chemo. She recommended alpha lipoic acid, acetyl L-carnitine, and other things. Those are to protect your kidneys. I mean, there's a load of information out there, people, but you need to be looking. So if you currently have a diagnosis of cancer, or you have a friend, family member, loved one, somebody who has cancer, please tag them in this video or share it into Messenger or copy or however you want to do it. Share it on your page. Let them know to look up Dr. Heather Paulson, because Paulson is Paulson. She has tons of great information, and she might be able to help you find somebody local to you that can guide you further in your naturopathic oncology journey. Okay, so I hope that is some good information for you. I know it was for me. That's it for today. I hope you guys are having an awesome Tuesday, and I'll be back tomorrow for another Live in 5.